I was recently going through Instagram when I got offered an ad about learning hypnosis in 2 days, and I thought that was absolutely fascinating. I spent at least 9 months going through my training program, many hours a day, and I thought that it was interesting that in 2 hours I could become a clinical hypnotherapist. And here's the thing about that. I just want everyone to know certifications are there's no governing body over certifications within the wellness sphere, and that's fine. But just know that when you're looking at people who are certified, where did they get their certification from and what does it mean? But also, there's one thing to just be able to hypnotize someone, but there's another thing to learn. What do you do with someone once they're in the hypnotic state, right? They're hypnotized and all of a sudden they start crying and they're twitching. What are you doing? They're not having a seizure, but these are the things that we learn through the appropriate certification methods and programs out there, is what to do with people when they're in that state. And it's also staying in your lane and within your boundaries of where you're allowed to work. Most hypnotists are not psychiatrists or psychologists where they have that ability to work with things like mental disorders, diseases, etc. So really a lot of the hypnotherapists out there, it's all about avocational self-improvement and not dealing with things like depression and heavy trauma. Those things might come up in our conversations, but they're not where we focus necessarily. And it's always great to work under the supervision of a therapist. A lot of hypnotists are afraid to even mention that they should go see a therapist because they're like, I'm going to lose that business. That's cuckoo bananas, because we want people to be getting better. We are not the sole source of healing at times. In fact, having a whole breadth of different modalities that can help someone is really important. Plus, to make sure that they're getting the right care is the ethical right thing to do. Making sure that if someone has trauma and drama that is going on in their life right now, that they have the appropriate resources to talk about what's happened in the past, right? To digest it, process it in the ways that a therapist has been trained to do. And then we can come in to really help move them forward, right? We don't want to work outside of our lane. These things will come up, like I said, in hypnosis at times, where, sometimes telling the story and part of the story is going back to hearing a little bit about it. But our job is to help move people forward, finding those alternatives of how we can offer support, what life can look like, be like, feel like, and moving the person forward. So I love therapy. I think there's a time and a place for therapy. I think it helps understand and digest and unpack the past of what has happened to bring an awareness. And then hypnosis can really help you understand it from a logical level to bring it back down to the subconscious, to new behaviors to bring you forward.